Hi everybody, this is Dr. John Chow, the inventor of the Pinhole Surgical Technique. I want to show you what to expect immediately after pinhole is done for you in 1 week, in 3 weeks, and in 6 weeks. So here we go. This is a lady that came to us December 18. We did upper and lower arch the same day. Altogether, it took about 2 hours. Now, we did the upper arch first. That took about an hour. So what you see on the top column, 1, 2, 3, going sideways, is the initial picture of the gums before we did the pinhole. Now the 3 pictures down below shows what the gums look like immediately after pinhole was finished about an hour later. You can see that the difference is dramatic. You can see that how the gums have gone down about half the length of the teeth. I jokingly say that when we do pinhole, your teeth would, for a time, look like baby teeth. Also, notice that we overcorrect and we thicken the gums underneath the teeth with a lot of collagen. So you see the thickness of the collagen there, which we caution our patients, don't try to press it away. Don't lick it. Don't try to undermine the thickness that we want, because when we're all done, the gums will be normal, but it'll be thicker and stronger than ever before. This is what the upper looks like. Remember I said we did upper and lower at the same time. So now the next set of slides show what the lowest look like. See the level of the gums after we're finished. See how, again, it's much further up. Don't be alarmed by the pinholes, which look so big. They look bigger because we did have to stretch the gums just to take the photos. Now, the new set of slides shows what it looks like the next day. Less than 24 hours later, look at now, the top is still the original, and the bottom 3 photos shows what it looks like after only 1 day or less than 1 day. See how it looks much pinker. It looks practically healed up, and the pinholes are nowhere to be seen. This is on the upper. The 1 day lowest you see on the next slide. Look at the lower. Remember you saw those big holes? They're practically gone. They kind of come together and they will heal really fast. See how much the gums have come up and how much thicker it actually is. The patient at this point is in very, very low grade pain, maybe on a scale of 0 to 10, patients are 1 or 2. She had taken a set of Tylenol with Advil the day before and 1 in the morning. Here, this is what it looks like in 1 week. Look at the photos of the teeth. It's still down, it's still thick, and the pinholes are hardly anywhere to be seen. If you really look, you can see a little bit of the pinholes there, but the gums are still thick. This is a very good sign that when the gums shrink, you'll shrink to an ideal level where we cover the exposed roots. But in addition to covering the roots, the tissue, when it heals, will be much thicker and stronger, but still very healthy looking. That's the uppers. Now look at the lowers, 1 week. You see the gums are not as swollen as before. You still see a little bit of the pinhole, but the gums are much further up than it was 1 week before the pinhole procedure. Now, let me show you what it looks like in 3 weeks. Look at the uppers now. It's still at practically the same level, but it's still very thick. This is a great case because when it heals, you look very normal, but it look a lot stronger, and you cover the defects much better than what it was before. Now this is the upper. Now look at the lowers. Now the lowers are going to shrink, and but the level is much higher and thicker than what it was before we started. Now you notice what's on that stuff, all that plaque on the teeth. This is the way it's supposed to be. We don't want the patient to brush or touch the gums. The gums heal much better if they don't touch it. So our very strong instructions to the patients are, don't touch the wound the first 6 weeks. Now, let's see the 6-week result. Again, look at the front teeth, 6 weeks. This is approximately where the gum line will be. Wherever the gum line is at 6 weeks, it probably will be what it is. Notice that it's not as thick as it was before. It's basically quite normal. So if you were to look at it, you didn't think anything was ever done, except all the roots that were exposed now are covered up. Now that's the uppers. And the lowers now the gum line is much higher. Now, we want to say something about lowers. Lowers, because there's so much loss of bone around the lower anterior teeth, that we always tell the patients that we're not looking at covering the roots there, we're looking at thickening the gums to prevent further gum recession, because the bone around those lower anterior teeth are very, very thin or nearly absent. So if we can thicken the gums, make the gums healthier and stronger, then we can prevent further bone loss and then be able to give a long-term prognosis to these teeth. In other words, we can give an optimistic assessment that the teeth will last long-term without any further recession or loss of bone. So you can see how the lowers on the left and right sides have also improved. So this is walking you through the steps immediately after surgery, the next day, the next week, the 3rd week, and the 6 weeks. Thank you for joining us.